Welcome back to Heart with Dr. Raj. I'm Raj Sugumaran, board certified interventional cardiologist and board certified lipidologist here in Phoenix, Arizona. Today's session is more of a Q&A session. There's been a lot of great questions in the comments section, and I'd like to maybe address some of them. I can't promise to get to them all, but we'll start with a couple of them. So one of the questions was, this was about somebody who has congestive heart failure and has been passing out a lot. And, in general, the act of passing out, going back to syncope, can be very dangerous. So anybody who is passing out a lot, I'm really worried about ventricular arrhythmias, specifically ventricular tachycardia and ventricular fibrillation. This can lead to death. So this is definitely an emergency. I would definitely recommend seeing a cardiologist to do more of a arrhythmia workup, specifically with heart monitoring devices. So that goes to that type of question. The next question is triglyceride goals. So in general, a normal triglyceride level is under 150. We get worried when it goes above 200. So we always ask a lot of questions about diet. What kind of processed foods are you eating? Saturated fatty acids, alcohol. So these are the three most common offending agents for increasing someone's triglycerides, on top of other metabolic conditions such as hypothyroid, nephrotic syndrome, etc. So another question was, my father has had diabetes, so does that mean I should be on a statin? So if you have a strong family history of diabetes, that means that there is a genetic predisposition for you to get diabetes. So you got to keep your guard up. Doesn't mean you have to be on a statin. So for anybody above the age of 50, we really want that LDL to be under 100, because as we age, the risk of heart disease and stroke goes up. So that's the answer to that question. And the final question is about supplements. Everybody wants to know about supplements. So in general, supplements are really exactly what they sound like. They're to supplement your health. Supplements are not FDA approved, and rarely are they actually part of a disease state treatment regimen. So if you've had a heart attack, stroke, heart disease, congestive heart failure, or a diabetic or any other disease states, supplements actually don't help. Certainly they can't cause any harm unless there's side effects, but we don't recommend supplements. We really want to attack the disease states with FDA approved evidence-based medicines. Now, I try not to hurt my patients' feelings by telling them that they can't take turmeric or elderberry or biotin or any of these vitamins. It's just, at the end of the day, what are you paying for? Are you paying for some idea